Um, Now, before I start my talk, I would like to ask everybody a question. When we are old, are we supposed to have urine leak? Is that a norm? Anybody? Are we supposed to have urine leak when we are old? No? Sorry? Yes. Why do you say so? Yeah? Well, I think it is, in a way it is right, because when we are getting old, our body changes. So a lot of things can happen along the way. Can you hear me? Right. Okay. So now, but it is important for us to know what type of urine leak that you're having. Because over a span of 25 years, I'm about 50 years now, if you do not know. Over a span of 25 years, I've seen different patients coming in with different complaints of urine leak. It's important for us to identify and to differentiate different types of urine leak because not all the urine leak are managed the same way. Because some of the urine leak, you can use medication. Some of the urine leak, you need to use a catheter. Some of the urine leak may be surgery. So it is important for us to know. Now, first of all, everybody leaks. Sometimes, when you know that, for example, a man who have just had a trauma, motor vehicle accident, he can end up leaking as well. Woman, whenever you cough, you sneeze, you carry heavy things, you can leak. And even the pediatrics are not spared. So now it is important for us to know there are different types of leaks because as you can see from here, the first type of leak is actually stress urinary incontinence. What do you mean by that? Does it mean mental stress? The answer is no. It means that whenever you cough, you sneeze, you carry heavy things, you leak. That is because of the weakening of the pelvic floor muscle. So that is one type of leak, most of the time encountered by women. Whereas the second one is urge. The moment you think about going to the toilet, when the thought of going to the toilet pop up, you have to run. And a lot of times when you don't make it in time to the toilet, you leak. That is urge incontinence. This is a different type of leak. And the third type is actually a mix. So you can have a combination of stress and also urge combined together. In fact, the mixed type of incontinence is actually the most common incontinence problem that we encounter. The last one is an overflow leak. That means to say that there are some patients, especially the diabetic patients, whenever they pass urine, they don't realize that they still have a lot of urine left behind. They are not able to empty the bladder properly. They go on drinking until it becomes overflow and start to leak. So this is a different type of leak. Now, so basically, whenever you cough, you laugh, you sneeze, you leak. So this is as what I told you earlier on, can happen to most of the women. And of course, the urge incontinence. The moment the thought of going to the toilet pop up, you need to rush to the toilet. And the last, of course, is the mixed incontinence. You can have both. And of course, I mentioned earlier on about the overflow incontinence. So now, coming back, as you can see from here, different type of incontinence is managed differently. For example, for those who have stress urinary incontinence, they don't actually respond to medication. Just imagine when your pelvic floor muscle is already weakened, the moment you cough, you laugh, it just opens up. This is not something that can be treated with medication. You know, you can go for physiotherapy, Kegel exercise, for example. Otherwise, you may have to go for surgery to tighten it a little bit, okay, when things become a little bit more severe. Whereas the other ones, such as urge incontinence, is something that you can treat with medication. So it's important for us to know which type of incontinence, because if you don't get the right treatment, you end up getting worse. Now, what do we mean by urine leak? The whole process of passing urine basically involves bladder contraction and pelvic floor muscle relaxation. That's when the urine comes out. For men, the prostate have to relax so that the urine comes out, all right? So this is the whole process of passing urine. Now, there are quite a lot of difference when it comes to men and women. So this is a side view. As you can see from here, the women's passage is only about 2 to 5 centimeter. Whereas for men's passage, the exposed end may be about 5 centimeter, but the inner part contribute another 15 centimeter. So we are looking at 2 versus 20. That's why whenever women cough, they leak. Whenever they laugh, they leak. Whereas men, they can cough until they die, nothing happened. It just won't leak. So that's the difference because obviously one is that short, the other one is that long. Okay? And also because of the fact that women's passage is so much shorter, and it's, sometimes it's easy for them to get infection. As you know, women tend to get infection much more common as compared to men. So now, back to the same question again. Urge incontinence most of the time is because of the drink that you drink, for example. If you are a person who is very fond of taking coffee, taking tea, taking carbonated drinks like Coca-Cola, Pepsi-Cola, alcohol, or even citrus drinks, orange juice, lime juice, they are all bladder stimulants. So let me repeat again. Coffee, tea, citrus drinks, carbonated product, and alcohol. They are all bladder stimulants. So if you are a person who is fond of taking this, obviously you always feel the need to rush to the toilet because it creates a lot of overactivity in your bladder. So this is what we call urge or overactive bladder, urge incontinence. Whereas for those patients who have stress incontinence, most of the time it's because of the weakened pelvic floor muscle. So when the pelvic floor muscle is not so strong, for example, those who have had multiple deliveries, they tend to get a little bit weak. Those who have had previous surgery done before tend to get a little bit weak. So those people tend to get a little bit more leaking problem. Whereas the third one is an overflow incontinence. For example, those patients who have diabetes, they do not realize that they have a full bladder because diabetic patients tend to have insensate bladder. They are not so sensitive anymore. It's just that they usually get extremities, numbness, also the bladder. The bladder feel a little bit numb. So whenever they have full bladder, they don't even realize that they have full bladder. Sometimes they leak. And occasionally it's because of the big prostate. When the prostate is growing bigger and bigger, they tend to stretch the bladder more and eventually become overflow and leak. So obviously, when you have leaking problem, you have low self-esteem, you tend to shun away from the social circle, and then it also poses a problem for the caretaker because imagine taking care of somebody who leak all the time, and you can spend a lot of money buying diapers, and these are all something that you really need to address. So again, when you're old, you're not supposed to leak. Why should you leak? So if you do encounter leaking problem, find out what exactly is the problem so that we can actually treat you accordingly. So, simple, I'll just put a case scenario. Now this woman complained of leaking, and obviously whenever she coughs, she leaks. And she used a couple of pads a day, okay? So she have tried all sorts of physiotherapy. As you know, sometimes when women cough and leak, the first thing that we advise them is to go for physiotherapy. Occasionally it works, sometimes it doesn't work. If you're a person who is very athletic before, you have very strong muscle, then the Kegel exercise work very well for you. But this is something that you need to continue. It doesn't mean that when you do the exercise for about 1 month or so, and then that's it, you leave it. No, you need to continue, all right? So, if it doesn't work, so obviously what she's having is a stress incontinence. She cough, she leak, is a stress incontinence. So this is one type of incontinence. Now, the reason is because, as you can see from here, this is the red color thing is a pelvic floor muscle. So the front is actually the bladder, followed by the uterus, and at the back is actually the intestine. So you can see all these things hold it together. All these things are held together by the muscle. If the muscle is weakened, the whole thing can just open up. That's why some women get prolapse, some women get stress incontinence, and some women get prolapse of the intestine as well. Now, most of the time, the risk factors are if you have a traumatic delivery. For example, those patients who have had difficult delivery, they need to use vacuum, they need to use forceps to take out the baby. Ended up, they will have traumatic delivery. So they are all more predisposed to urinary leak. Second one, multiple vaginal delivery. If you're talking about 1 delivery is fine, 2 deliveries is fine. If you're talking about 5, 6, 7 deliveries, sometimes the muscle become a little bit weak. So it is not unusual that you get this stress urinary incontinence. Previous pelvic surgery, if you have hysterectomy done, you have any form of a major surgery done around this area, naturally you can leak. And of course, obesity as well. Weightlifting, as I told you before that, if a person have chronic cough and they don't address the issue of chronic cough, they always exert the pressure down there, challenging the pelvic floor muscle. Eventually it becomes weakened and the patient leak. And of course, the menopause is also one of the reasons why they tend to leak a little bit more. Now, for men, they encounter this kind of leaking. Whenever they cough, they leak. It is not very common in men. Usually, they don't have this problem unless they have a prostate surgery. Now, the incidence is not very common. It's only about 1 to 5%. So if you have had a good surgery, you will not end up with leaking. But if you have had a botched surgery or bad surgery, sometimes after the prostate surgery, you end up with leaking. All right? So as you can see from here, this is the prostate tissue. Whenever we do the prostate surgery, what we do is that we core out the middle part, the obstructing part. So creating a cavity there so that the man can pass urine better. But sometimes that can lead to leaking as well. Now, occasionally, those men who have trauma, you can see that the whole pelvic bone go haywire. So in that case, obviously the whole anatomy is disrupted. So that's why they leak. Now, there are a lot of things that we can do. We can go for blood tests, we can go for urine tests, we can go for a scope, put a camera in there, we can do for all sorts of investigation to find out what sort of leak that the patients are suffering from. As I told you before that, if a woman have this cough and leak problem, the first thing that we ask them to do is to go for physiotherapy. So you can see there are various forms of physiotherapy. You must understand that you must exercise on the right muscle, because there are some people who exercise on the wrong muscle. After 6 months, there's still no effect at all. So the best advice is to see a physiotherapist, teach you how to exercise on the right muscle so that you can actually get on with it and you can see the improvement. Now, for those patients who have tried physiotherapy and never really worked, so what do we do? Obviously, this is a bladder. Whenever they cough, it opens up. So what you need to do is that you want to put it back into its original position, hold it back together. So in that case, what we do, we put a tape inside there. It's a very small surgery, about half an hour, bring everything together, and that's it. Then the patient will not leak anymore. So this tape is a foreign body. It stays in with you, okay? We are not going to take it out. Now, what about for men? Same thing as well. We can also put the same thing for men. So not just for women, the same tape can be applied for men as well. Now, for those patients who have very, very severe leak, they leak like a tap. So what do we do? There's something called artificial urinary sphincter. It may be a little bit difficult to understand. Just imagine, this is the scrotum, this is the penis, the bladder is here, yeah? This is the bladder. So at all time, this cuff is filled with water. So it closes. So the man is dry. But the moment he wants to go to the toilet to pass urine, all that he needs to do is to press the pump here. So when he presses the pump, the water from here is going to go into the reservoir. Then it opens up. So I repeat again, this cuff, which is occluding the urinary passage, is filled with water. So it's closing the passage. That's why the man is dry. So the moment he wants to go to the toilet, all that he needs to do is to press the pump here. So when you press the pump, the water from here is going to go up to the reservoir and it opens up. So the man can pass urine. And the good thing about it is that after 1 or 2 minutes, this thing is going to go back and fill up the cuff again. And then he becomes dry. So you just have to press 1, pass urine, 2 minutes later, it closes back. So that's why the patient remains dry. So this is obviously meant for very, very severe leak. Some patients actually have to use up to about 10 pads a day. So for that, the sling or the tape does not work. So you have to go for something a little bit more. For elderly patients, sometimes they cannot go for general anesthesia because they're just not so fit. Maybe with multiple medical problems like high blood pressure, diabetes, heart problem, cholesterol, and all these things. Is there anything that we can do local anesthetic? Now, yes, the answer is we can actually inject a little bit of a silicone onto the passage. Imagine this is a bladder. So you leak from here. All that you need to do is to make it a little bit, closing, all right? A bit more approximation, so the patient will not leak that badly. This one can be done under local anesthetic agent. It's only about 5 minutes. It's a daycare surgery. Do it and go home. Case number 2. Now, this 68-year-old man had a previous stroke, and then after that complained of urine leak. But this is associated with urgency, so you need to rush to the toilet. So this is a different type of leak already that we are talking about, okay? So he obviously have to wear about 6 diapers a day. So this is not the stress urine leak, this is an urge urine leak, a completely different type of leak. What do we do? Can you imagine when you have a bladder, the bladder capacity is usually about 400 ml. Okay, you can store the urine up to about 400 ml. So you have anything which is less than 150 ml, you do not know that there are presence of urine. The presence of urine come about only when you have 150 and above. So you feel the first time that there are a lot of urine inside there. But when it goes up to about 400, you need to rush to the toilet. So for those patients who have overactive bladder, they don't need to have 150 to feel it for the first time. They can have 30, they can have 50, they already need to rush. All right, so this is overactive bladder. Now, it can happen because of neurological issues. As I mentioned just now, those patients who have stroke, who have Parkinsonism, who have Alzheimer's, sometimes they can have this urgency to rush, okay? So this is a different type. Now, spinal cord injury, those people who have accident at the back there, destroy the nerves. They can also have this urge incontinence. As I told you earlier on, some of us like to take coffee, tea, carbonated product, alcohol. All these are bladder stimulants. It makes your bladder contract too much and you have to rush to the toilet. So the first thing to do is to take away all this. Or you can take decaffeinated coffee, decaffeinated tea, or you can just stop from drinking, alcohol, even citrus drinks. That would definitely make it better. Some of us actually overdrink. Do you know that the amount of drink that you need to have per day is only about 2 to 2.5 liter? 2 to 2.5 liter. That is almost about 6 cups a day. If you were to overdrink, a lot of us think that, okay, I tend to get urinary tract infection. I drink more, it's going to flush out the thing, flush out the dirty urine. It is not true. Why is it like that? Because you just need about 6 to 7 glasses. If you were to overdrink, you overfill your bladder. It makes you go to the toilet all the time. The normal way of drinking is every 3 hours once, and every 3 hours you pass urine, and that's about it. You don't have to overdrink, because whatever you drink is going to come out. When you drink, 45 or 1 hour later, it's in your bladder. If you drink too much, you're just sending yourself to the toilet all the time. It's completely unnecessary. Now, of course, for those people who actually exercise a lot, who go to the gym, who work under the hot sun, they tend to get dehydrated, so they need to drink more water. That is normal. But normal people, 6 to 7 glasses, more than enough. So for those people who have overactive bladder, all that you need to do is not to go for physiotherapy. You can go for physiotherapy. It helps to a certain extent, but usually not much. You can use medication. So if you have stopped all the caffeinated product, carbonated product, and it's still not working, you can use medication. What it does, it relaxes the bladder a little bit, okay? Because you have this overactive bladder and makes you leak, right? So what you want to do is to take the medication to relax the bladder. So many medications. Now, we know about Botox. Does everybody know how Botox works? You know that we use Botox to inject on this area. What it does is that it paralyzes the muscle. So if you have a wrinkle like this, it looks horrible. If you have a wrinkle like this, it looks horrible. So what we do, we inject the Botox, paralyze the muscle, then the whole face here look very flat and nice, and there's no wrinkle because the muscle is paralyzed. Likewise, for those overactive bladder, because your bladder is hypercontracting, you can literally inject Botox inside there to half paralyze it so that it doesn't contract so much anymore. Obviously, not completely paralyzing, just half paralyzed is fine because the Botox effect doesn't last very long. For those women who actually go for Botox, every 3-4 months they have to go for it. For bladder, usually about 6 months to 1 year, all right? Now, obviously, there are also other things like, something like an acupuncture. We have to identify the nerves here because some of the nerves are actually joining all the way up to supply the bladder. So all that you need to do is to come to us and then we can actually do something like an acupuncture, stimulate the nerve, then we can relax the bladder. And of course, ultimately, you know that the bladder contraction is all governed by the nerves that come from the back. So if the patient you have tried everything, try the medication doesn't work, try the Botox doesn't work, try the acupuncture doesn't work, this is the ultimate one. What we do is that we put a pacemaker here. We all know that the pacemaker is meant for heart. It makes the heart beat in a rhythmic pattern. Likewise, if your bladder is not beating in the right way, you can actually put a bladder pacemaker as well to make it contract in the normal way. So it works on two ends. For those patients who have not had any bladder contraction, ended up with urinary retention to wear the catheter, they can have this. Those men who actually have severe overactive bladder, not responding to anything, they can have this as well because the bladder pacemaker works on both ends. Now, case number 3. 86 years old man, non-diabetic for 50 years, diagnosed to have huge prostate gland. So he presented with difficulty in passing urine. This seems like so familiar. It's a very common scenario. So what type of stress incontinence he's suffering from? Overflow. Why? Because you imagine this is a bladder, down there is a prostate. If your prostate is occluding the passage, obviously you can't finish passing urine. You can never empty the bladder. So eventually you drink water like normal, it overstretches the bladder until it becomes overflow and start to leak. So it's not unusual for us to see patients like this. An elderly man come into the emergency department having something like this. It's almost like a pregnant woman. You know that I told you before, the bladder can accommodate up to about 400 ml of urine. So if you have something like this, I'm not surprised. When you put a catheter in, you probably drain about 2 liter, 2000 ml. So this is because of a huge prostate obstructing it for a long period of time. Now, can you see that this is a bladder, this is a normal prostate? So if you have a humongous prostate like this, what's going to happen? Obviously, the bladder is obviously not able to empty the urine. Eventually, it becomes overfilled and they start to leak. So this is a different type of leak, okay? Now, sometimes when you have a stone which is obstructing there, it's almost like a big prostate obstructing there at the outlet, so they cannot pass urine. So that can lead to leak as well. Some patients who have diabetes. Diabetic patient, as I told you before, they don't have a proper sensation. They don't feel the need to go to the toilet. A lot of time they overstretch the bladder until it becomes so full, only they feel the need to go to the toilet. But most of the time, they don't even know that there are a lot of urine inside there because the bladder becomes a little bit numb. So in that case, they can overfill their bladder and eventually leak. So this is what we call diabetes and spinal cord injury as well. So this problem can happen in those patients. So what do you do? If the patient have a big prostate, do the surgery. If the patient have a big bladder stone, take out the stone. If the patient have, now there are also some patients are actually on antihistamine. There are some patients who are on sleeping pills, antipsychiatry, antidepressant. These are the medication that causes too much of relaxation in the bladder. So in that case, for men who already have a big prostate down there, already trying having a lot of difficulty trying to pass urine, if you were to take those medications, it relaxes even more. So ended up the patient go into retention. So, is there a treatment for this type of leak, overflow leak? The answer is not medication. The answer is not surgery. You have to put a catheter inside there, okay? Because otherwise they cannot pass urine. Now somebody can ask me a question, is there any medication to make the bladder contract like normal? The answer is no, there's no medication. Whoever that invent the medication will be a Nobel laureate, will win a Nobel Prize. There's no medication in this world that can make the bladder contract like usual. So obviously, as I told you before, you have a bladder pacemaker that can make the bladder contract like normal again, but it's a bladder pacemaker. So now, for men who actually leak like crazy, they have to wear diapers. And some of them resort to using a penile clamp, just to clamp on the penis so that they don't leak that bad. But after a long time, the penis tend to get eroded and get a lot of infection issue. So this is not a good idea. So, importance in the continence care, because if the patient continue to leak, this is usually what we see. Macerated wound, dermatitis, all sorts of fungal infection maybe. You can see that? So, it's important for us to actually take care of all this leaking area because you know that they tend to have infection and they tend to become very red and itchy. So use the right cream, make sure that the hygiene is taken care of, make sure you wash the area. And of course, sometimes we need to clear up all the feces and urine and all these things. For some patients who are moribund, who is bedridden, make sure that they are not constantly soaked with all this urine and feces. Now the take-home message is that urine leak can happen in both men and women, okay? So it is not just for women alone, men also suffer from it. It affects the social lifestyle because you tend to shun away from your friends because you feel the embarrassment. As you know, if you were to leak, sometimes we tend to think that, okay, there's a bit of a smell around us. So psychologically, you are obviously affected. You get depressed. It is not an inevitable part of aging. Doesn't mean that when you're old, you're supposed to leak. Remember, even when you live up to about 80 years old, 90 years old, you are not supposed to leak. So it is important for us to identify what sort of urinary incontinence that we are talking about here. Are we talking about overflow leak? Are we talking about stress leak or are we talking about urge leak? Because they are all different treatment. So we have all the things to handle all these things. And of course, we can offer a wide range of treatment modalities. 3% of the world's population is affected by incontinence, as you know. 1 in 10 women have incontinence problem in Malaysia. 1 in 30 men have incontinence problem in Malaysia. 15% of the elderly patients have incontinence problem. Thank you.
Now, do we have any questions for Dr. Warren? Oh, we have a question right at the front here.
Good afternoon, doctor. I have a question. I take care about 20 elderly persons. I live in 20 elderly persons at an old folks home. It's a non-government organization. As you have just now mentioned, that older people doesn't mean you need to have prostrate and so forth. But these people, when I bring them to the doctor, they said it's common for men over 50 to have prostrate. Now, you said you're not supposed to have it. So where do we stand on this scenario?
Your question is that most of the elderly people leak. Okay. Number one, women and men, they leak differently. Obviously, you know. Yeah. So women, most of the time, it's because of the stress incontinence. So if they have previous multiple deliveries and all these things, sometimes they leak. And also, women 2 to 5 centimeter passage also tend to leak because the passage is very short. Support is not enough. They are born this way. There's nothing that you can do about it. All right. So, but when it comes to elderly, it just tends to get worsened because our muscles tend to get more and more weak. That's the reason why the incontinence become more obvious. So that is for the woman part of it. Your question is that men above 50 years old tend to get prostate problem. Is that common? The answer is yes. Why? Because women, the hormone after 50 years old shut down. So they go into postmenopausal. But whereas for men, our hormone continue until we die. But after 50 years old, our hormone go haywire. There's a lot of imbalance in male hormone and female hormone in our body, and that leads to prostate enlargement. Now, if you were to ask me, okay, if this is a hormone issue, if I were to take out my testicle, will I have prostate problem? The answer is no. If you are a eunuch, you won't have prostate problem. But who will take the drastic approach to take out the testicle just because they do not want to have a prostate problem? Nobody, okay? So yes, prostate enlargement is a norm in all men after 50 years old. But some men don't feel it so early. Some men feel it at the age of 50, 60. Some men feel it at the age of 80. But the truth is that the prostate starts to enlarge after 50 years old. Now, why do some men feel it, some men don't? Is because some men, when they pass urine, they think that they are emptying the bladder, so they think that they have no problem. But in actual fact, they are not emptying the bladder. I mean, you never know how much you have emptied and how much is left inside there, isn't it? So, prostate is an ever-growing. As you grow older and older, the prostate becomes larger and larger. So most of the time, when we give medication, is to relax the lumen so the patient can pass urine a bit better. And that also works up to a certain time. After a couple of years, you know, the prostate have grown so big, there's no space to relax anymore, and that's the time whereby we advocate the surgery. So if the man live in ignorance, for example, having this prostate enlargement, passing urine is actually an overflow leak because when the bladder becomes overstretched all the time, when he strains to pass urine, it comes out, he thinks that he's passing urine like normal. In fact, it's actually an overflow leak rather than passing urine. So this is not the normal way of passing urine, isn't it? So yes, men as they grow older, they can have prostate enlargement, and that sometimes can lead to overflow leak. The other thing is that when the prostate is so occluding, what happens is that the bladder have to push extra hard for the urine to come out. Inevitably, the normal bladder contraction is turning into an overactive bladder because they have to work extra hard to push the urine out. So that leads to overactive or urge incontinence. So it's a different type of incontinence. So you have to address the problem. For women, if it is something which is like weak pelvic floor muscle, go for physiotherapy. If it doesn't work, then go for surgery. For men, if it is because of the prostate problem, address the prostate issue. That's all you need to do. Sometimes you can just take the medication. Not necessary that you have to suffer in silence. But unfortunately, a lot of us actually suffer in silence.
Wow. Thank you very much, Doctor. That's fantastic. Big round of applause.
Thank you.